The human metabolism operates as a delicate, interconnected network. When one part misfires, that single disruption cascades across the system, resulting in conditions like diabetes, thyroid dysfunction, and high blood pressure. The standard response to a new diagnosis is a moment of panic, followed quickly by a prescription. You take the medication to suppress the immediate symptoms. But relying entirely on medication leaves the root of the problem untouched. It masks the daily dietary and lifestyle habits actively driving the disease in the background. Integrative medicine offers a different route. It combines the diagnostic precision of modern healthcare with proactive, evidence-based nutrition and lifestyle strategies. Managing a chronic condition requires a choice. You have to choose between the passive convenience of a daily pill and the active daily friction of managing your lifestyle. Because integrative care requires significant effort, trying to change your entire life overnight usually fails. You have to match your intervention exactly to your current stage of health. This flowchart, the chronic care matrix, maps out 3 distinct starting points to help you identify your baseline: early warning signs, the daily diet grind, and system overload. The first path is for patients noticing early symptoms, or those newly diagnosed, who need immediate baseline screening before taking action. The second path covers people actively trying to manage their blood sugar, but getting tripped up by misleading food marketing. The third path is for patients already managing thyroid or hypertension with medication, but who need a structured daily routine to regain control. Pinpointing exactly where you are on this matrix is the only way to calculate if the required effort makes sense for your long-term health. Let's look at the first group. You might be noticing confusing physical changes, like sudden weight fluctuations, chronic fatigue, or unusual thirst. There are 3 distinct types of diabetes: type 1, type 2, and gestational. Guessing which one you might be dealing with based on physical symptoms alone is medically dangerous. This checklist displays the 4 essential glucose screening tests doctors use. Committing to these screenings provides hard data on your metabolic function. Completing these tests requires an upfront cost. You have to take time out of your day, pay for the lab work, and face the anxiety of a potential diagnosis. But identifying metabolic dysfunction early allows you to make minor, manageable adjustments to your meals and activity, avoiding radical, irreversible interventions down the road. The initial anxiety and friction of booking that first screening test is the cheapest price you will pay to protect your metabolic health. Our second group includes those actively trying to control their blood sugar through diet, but finding themselves overwhelmed by conflicting nutritional advice. A major trap here is commercially marketed diabetic biscuits and sugar-free snacks. They remove the sugar, but often replace it with artificial additives and unhealthy fats. Compare those processed snacks with the confusion surrounding natural, whole foods. Many people avoid sweet fruits like bananas and dates entirely out of fear they will spike their glucose levels. This quadrant chart plots the biological impact of these foods against each other. Diabetic biscuits score high for glycemic impact, but offer low nutritional value. Bananas and dates sit in the moderate impact, high nutritional value zone. Eating whole fruits in strictly controlled portions supports your daily energy and health far better than eating highly processed, zero-sugar alternatives. To do this safely, you have to read every label, count your carbohydrates, and physically measure your portions. You lose the ability to snack mindlessly. Every meal becomes a deliberate calculation. Optimizing your diet means trading the convenience of grabbing a package off the shelf for the strict discipline of metabolic math. The final group consists of patients already taking standard medications for established conditions like hypertension or thyroid dysfunction. Pills can supplement thyroid hormones or force your blood pressure down, but they cannot overcome a daily routine that is actively working against the medication. For thyroid health, you have to identify and eliminate specific, often healthy-seeming, foods that block your thyroid from functioning properly. This table compares the approaches. Standard care relies entirely on medication. An integrative care plan requires medication, plus daily blood pressure monitoring, dietary restrictions, and lifestyle tracking. If you have hypertension, this means building a non-negotiable routine of checking your blood pressure at home every single day and logging your stress levels. The result is steadier daily biometrics and an optimized metabolism, which allows your prescribed medications to work efficiently. The cost is heavy. It complicates your meal prep, makes eating out difficult, and turns you into a full-time accountant for your own biology. Managing a chronic condition long-term requires stopping your role as a passive recipient of healthcare and becoming the active manager of your own body. Specialized facilities like Arka Anugraha Hospital practice integrative medicine by merging clinical technology with active lifestyle support. While an integrative approach creates a higher long-term quality of life, the daily effort required to maintain that baseline is non-negotiable. A hospital can provide advanced diagnostics, structure a nursing care plan, and give you the roadmap, but you have to execute the behaviors in your own kitchen and your own living room every day. Treating your health as an ongoing optimization project means accepting the daily tax of routine and discipline. This scorecard helps evaluate your path. It matches your health profile against the daily inputs of monitoring, strict diets, and screening. If you are looking for a quick fix or refuse to part with heavily processed foods, this approach will not work for you. This path is for proactive individuals willing to measure outcomes, adjust meals, and endure short-term friction for long-term vitality. Look at this matrix and honestly identify which of these 3 segments reflects your current health. If you fall into one of these categories and you are ready to put in the daily effort, book a consultation with an integrative health specialist to establish your medical baseline today.